It's hard to believe, but this year marks the 30th anniversary of the downtown New Year's Eve Buffalo Ball Drop. Now that's 3 decades of celebrations, fireworks, and of course, tons of memories. Well, this year is extra special because the Greater Buffalo United Accountable Healthcare Network is a proud sponsor of the event. And CEO Dr. Raul Vasquez joins us this morning. Dr. Vasquez, how exciting is this to be a part of the Buffalo Ball Drop?
Oh, it's amazing. It's really cool. It's really cool.
This is Gbuahn's first year to be a part of this. How much is the company looking forward to this?
Well, I think our teams have really been excited about it, so it'll be fun. I think it's something new for us, but we're doing the right things for the community, so that's always the right thing. We feel good about it.
Speaking of the community, let's talk about Gbuahn and what you do for Western New Yorkers.
So, I mean, we're actually a pretty decent-sized company. We have 175 employees. We do a lot of care coordination, so patients that are on Medicaid with 2 chronic diseases like diabetes, hypertension, that are often lost in the system, we help kind of guide them through so they're not ending up in emergency rooms and admitted to the hospital for the wrong reasons. Really try to get them back to their primary care doctors or just guide them in terms of how to better manage their diseases.
Dr. Vasquez, talk to us about some of the services that Gbuahn provides from day to day.
So, I mean, we got a couple of things. We just built our new facility, so in the bottom floor we have a full gym and a nutritional kitchen, and also we have what are called health coaches that are helping people kind of guide them as to what they should be eating. So that's that one floor. We also have primary care services and behavioral services that are part of the medical establishments that we partner with. So that kind of helps patients. If you're lost and you don't have a doctor, we can pretty much get you assigned to it. And we're also we transport patients. So if you don't have transportation, we're able to kind of get you in for the services.
And as you mentioned before we were on air, Gbuahn continues to grow by the year. You're now up to more than 170 employees?
Correct. That's
unbelievable. And you also continue to be involved in the community. What else do you do for Western New Yorkers?
Well, I mean, we're always trying to evolve to see where the needs are in the community and try to fill that void. So one of the things that we're looking to do this coming year is we're opening up on Jefferson, so we're opening up the primary care that was shut down to kind of provide primary care services there. In addition to, in February, going live with some transportation, G-Transport, just to be able to make sure people get to the right places at the right time. You know, making sure they come into the medical visits, that they can get home, their medicines at home. Because, you know, I think it's really important for us in medicine to kind of break the silos. And a lot of individuals, just the health literacy is not there. They may not know how important things are. And we're trying to kind of fill that void. Some of the things that, as a result, the outcomes that have come out of what we do is ER inpatient admissions have dropped in the population that we manage, and we've got over 8,000 members that we follow. So it's a lot of individuals, and we've been able to really help in those areas.
So why should someone come to you? For our viewers listening at home, why would someone come to Gbuahn?
Well, I think, you know, first of all, Medicaid, 2 chronic diseases, but if you're really caught in that situation where you're finding yourself going to the ER, finding out that your diabetes is not well controlled, that your blood pressure is not well controlled, that you may have, you know, depression that's not being managed, is what we end up doing is hooking you up with the right services, getting you on the right medication, making sure that you're getting the proper care at this time. And I think what that does is really, if you have better health, then you focus on important things. Then you get to work, you do other things that you haven't been able to do, but also taking care of the simple barriers. You know, we have a pantry. You know, transportation. Those areas are areas that are social determinants of health that are barriers that sometimes patients need. And what we try to do is supplement those things.
Well, Dr. Vasquez, thank you so much for joining us today, and we are so excited to have you be a part of counting down the days to 2018, one of our key sponsors this year. That's Gbuahn. Thank you for being a proud sponsor of the Buffalo Ball Drop, and Happy New Year to you.
You too.